Hi, I'm Rachel. I'm one of the technicians here at DLEAH. Today I'm going to demonstrate bottle feeding orphaned kittens. First we start out with the kitten milk replacer. Here we use the brand KMR. You can get it in this can pre-mixed. When I have large litters that I'm doing, I usually buy the powder because it's more cost effective. And then you just reconstitute it. It is 1 part powder to 2 parts water for the KMR brand, which is what I have in here. So first what I'm going to do is warm it before I feed the kittens. What I like to do is just make a warm water bath. So just get pretty warm to hot water, put it in a container, and then I have 2-ounce nurser bottles for the kittens. That's pretty much the only appropriate size for them. Any bigger, the nipple's going to be too big for them. So I'll just shake this up again, make sure it's nice and mixed, and then I'll add it to my bottle. And then I'll go ahead and put this bottle into the warm water bath so it can get up to a warm temperature without making it too hot and having hot spots by putting it in the microwave that could burn the kittens when they drink it. Okay, so my formula is now up to temperature. It's slightly warm. I can touch it on the inside of my wrist without it being too hot, so that's okay to give. I have one kitten here. He's about 3 weeks old, so he still needs to be bottle fed. Basically on these bottles, when you get them new, they're going to be sealed, so you'll just want to cut either with scissors or a needle, just cut a little X in the top so that when they suckle, the milk will come through for them. And their perception is still not great, so they'll have trouble finding the nipple at first. You just have to help guide it into their mouth. He's gotten pretty good at this, so he latched on right away. You'll see they'll have a good suckle. Their ears will kind of do that twitching, and he has a good latch onto the bottle. When they're this big and they're eating really well, I typically will just let them eat as much as they want, as long as everything else is normal with them. If they're urinating, defecating normally, that's fine. They usually will just stop eating when they're full. Sometimes it's hard to get them going, especially when they're younger. They have a little bit harder time latching on. What I like to do then, they'll just kind of be chewing on the nipple. I like to just put a very gentle pressure onto the bottle to just get a little bit of a stream going into their mouth, and that will usually allow them to then attach and start suckling. For the younger ones, I got this litter of kittens at about 1 week, so they were pretty small when I first started. For them, I usually just follow the recommendations on the milk replacer for the volume they get and how frequent. It can be up to every 3 to 4 hours to every 6 hours, like for when you're sleeping through the night or something. So usually about 4 to 5 times a day they're getting fed. As the volume goes up, you can kind of spread out how long in between. So I go more about every 6 hours, and at this size, they're all drinking about 15 to 25 milliliters of the milk replacer every feeding. So they're pretty self-sufficient at this point, and he tells me when he's done. He stops suckling, he doesn't want any more bottle, he turns away. He's full. After I feed them, I'm going to stimulate them to urinate and defecate. It's kind of what their mom does when they have them. She'll lick at their perianal area, which will stimulate urination and defecation. So it helps keep them regular and more comfortable as before they learn to use a litter box. I like to use cotton balls because it's very gentle on the area. I come over to the sink just for ease of cleaning up and take a few cotton balls, just some lukewarm water. I'll moisten one of the cotton balls with so it's not dry and rough on there, and then I'll just start to stimulate him by rubbing the cotton ball. As they get older, they do get more irritated with this, hence the screaming, but once you get going, they usually relax. He has a nice stream of urine coming here, and I will just keep doing this until he's all done. Ready, set, rinse! Oh man, okay. All right, and this is how we bottle feed kittens here at DLEAH.